When something serious is going on internally inside of the body, the skin can be the first place that a sign shows up, right? And this could be a rash on your cheeks, a strange purple spot on your legs, or intense dryness that no lotion seems to fix. We are going to take the time to walk you through when your skin is trying to tell you something about your overall health, specifically regarding an autoimmune condition called Sjogren's disease, how to spot it, and what you need to do. One of the things that we learned during our dermatology training is to recognize some of these signs and know how to act and when to act. Another benefit of our training is to know when something is actually not serious and not something that you need to worry about. The purpose of this video is not to scare anyone. It's to help you recognize some of these signs. Maybe you've seen them in yourself, or maybe you have a family member that has this. If you recognize these signs, it may be a good time to go see a dermatologist or a rheumatologist to make sure something more serious is not going on internally. They say that the eyes are the window to the soul. I believe as a dermatologist, the skin is actually a window to what's going on internally. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. So, let's look at what your body might be trying to show you. Here we go. 1. Xerosis. Extreme, unrelenting dry skin. The very first sign we need to talk about is profound, generalized dry skin, which is scientifically referred to as xerosis. Now, let's be fair, everyone gets dry skin from time to time, right? If you live in a cold climate, use harsh soaps, or turn up the central heating in the winter, your skin is going to get dry and flaky. But with Sjogren's disease, we are talking about an entirely different level of dryness. Sjogren's is a systemic autoimmune condition where the body's immune system mistakenly targets and attacks its own exocrine glands, specifically the moisture-producing glands. While the disease is classically famous for destroying the lacrimal glands in the eyes and the salivary glands in the mouth, causing severe dry eyes and dry mouth, it doesn't stop there. The immune system also sets its sights on the eccrine, sweat, glands and sebaceous, oil, glands embedded deep within your skin. When these glands are infiltrated by inflammatory cells, they lose their ability to produce the essential sweat and sebum needed to maintain your skin's natural lipid barrier. Without this barrier, moisture rapidly evaporates from the skin's surface. This leads to a severe, rough, scaly, and lizard-like texture. The skin becomes so brittle that it cracks, splits, and tears easily, completely unresponsive to standard over-the-counter body lotions or cosmetic body oils. If your skin constantly feels like an absolute desert no matter how much heavy moisturizer you slaughter on it, your body is flashing a major internal warning sign. If your skin feels like a constant, flaky desert that no moisturizer can fix, type desert in the comments section right now. Put it in the chat. 2. Palpable purpura, cutaneous vasculitis. Next up on our list is a sign that always commands immediate attention in a dermatology clinic. Tiny, raised, reddish-purple spots that typically erupt across the lower legs, ankles, and feet. In the medical world, we call this palpable purpura. To break that down simply, purpura means bleeding under the skin, and palpable means you can physically feel it with your fingertips. If you press a clear glass slide against a normal red spot on your skin, it will usually blanch, meaning the redness temporarily fades because you are pushing blood out of the capillaries. However, with purpura, the blood has actually leaked out of the vessels and pooled directly into the surrounding skin tissue. Because of this, when you press on it, it does not fade at all, it stays bright red or purple. In the context of Sjogren's disease, palpable purpura is a direct cutaneous manifestation of cutaneous vasculitis, which is a formal term for inflammation of the small blood vessels. When your immune system is in a state of hyperactivation, it creates an excess of inflammatory proteins and immune complexes. These complexes travel through the bloodstream and physically settle inside the walls of your smallest blood vessels, particularly in the lower legs where gravity increases blood pressure. Your white blood cells then attack these complexes, accidentally destroying the blood vessel walls in the process. The vessel walls tear open, blood leaks into the tissue, and localized swelling occurs, making the purple spots feel raised and bumpy. This is a critical sign that requires an immediate medical workup, because if blood vessels are inflamed on your skin, it means there is a high likelihood of active, systemic inflammation occurring internally as well. If you have ever noticed unexplained, raised purple spots on your legs, type purple in the comments right now. Put it in the chat. 3. Annular erythema, ring-shaped rashes. A highly specific and visually striking skin sign we look for during an examination is annular erythema. The word annular comes from the Latin word for ring, and erythema simply means redness of the skin. These lesions manifest as raised, red, ring-shaped patches that most frequently develop on the face, the neck, the upper chest, or the trunk. They often feature a vibrant, raised red outer border that slowly expands outward, while the center of the ring appears clear or slightly pale. To the untrained eye, this looks almost exactly like a classic target lesion or a common case of ringworm, tinea corporis. Because of this resemblance, many patients spend months applying over-the-counter antifungal creams, wondering why the rash refuses to clear up. But this isn't a fungal infection at all. In Sjogren's disease, annular erythema is deeply intertwined with the presence of specific autoimmune antibodies circulating in your blood, specifically anti-Rho SSA and anti-La SSB antibodies. The rash is caused by a dense infiltration of lymphocytes, a type of white blood cell, rushing into the superficial layers of the skin in response to autoimmune signaling. These rings can flare up out of nowhere, linger for several weeks, and then gradually fade away without leaving a permanent scar, only to pop up somewhere else a month later. If you notice these mysterious, expanding red rings developing on your skin, a dermatologist can perform a minor punch biopsy to look at the cells under a microscope and confirm if an autoimmune disease is driving it. Drop the word rings in the chat right now if you have ever developed a circular rash that wasn't ringworm. Let us know. 4. Raynaud's phenomenon. Let's talk about a fascinating yet deeply uncomfortable vascular sign that happens primarily when your hands or feet are exposed to a sudden drop in temperature. Raynaud's phenomenon. Imagine walking into a heavily air-conditioned grocery store, reaching into the freezer aisle to grab a cold beverage, or stepping outside on a chilly morning. Suddenly, without warning, one or more of your fingers or toes turns stark, ghostly white. It looks as if all the life has been completely drained from the digit. Shortly after, as the lack of oxygen continues, the tissue can take on a distinct blue or purple hue. Finally, when you get back into a warm environment, the blood vessels violently snap back open, causing the area to turn bright red, accompanied by an intense, throbbing pain, tingling, or a burning sensation as the blood flow rushes back. What is happening here is an extreme, over-dramatized spasm of the digital arteries. In normal physiology, when your body gets cold, your blood vessels constrict slightly to keep warm blood close to your core organs. But in Raynaud's, the smooth muscles in the blood vessel walls go into a state of total lockdown, completely shutting off blood flow to the extremities. There are two types of Raynaud's: primary, which happens on its own in completely healthy individuals, and secondary, which is caused by an underlying connective tissue disorder. A very significant percentage of individuals diagnosed with Sjogren's disease suffer from secondary Raynaud's. If you are experiencing this severe color-changing phenomenon in your hands, and it is happening alongside chronically dry eyes, a sticky dry mouth, or unexplainable joint aches, it serves as a massive piece of the diagnostic puzzle for your doctors. If your fingers or toes turn completely white or blue when you get cold, comment the word freeze below. Put it in the chat. 5. Angular cheilitis and severe lip fissuring. Moving up to the face, let's take a close look at the mouth area. A common and deeply painful sign that Sjogren's patients deal with is the development of severe cracking, splitting, and bleeding at the exact corners of the mouth, accompanied by chronically peeling, dry, and fissured lips. In the dermatology clinic, we call the cracking at the corners angular cheilitis. To understand why this happens, we have to look at the primary damage Sjogren's inflicts on the body. As the autoimmune process systematically degrades the salivary glands, your oral cavity undergoes a drastic reduction in saliva production. Saliva isn't just there to help you chew and digest food, it acts as a continuous, protective, antimicrobial bath for your entire mouth and lips. It contains specialized proteins and enzymes that keep harmful pathogens at bay and keeps the delicate mucous membranes hydrated. When saliva production drops to a crawl, your mouth becomes a hotbed of dryness. Because your lips feel incredibly dry, You naturally tend to lick the corners of your mouth over and over again to seek temporary relief. But as that ambient saliva evaporates, it takes the skin's natural moisture with it, leaving deep, raw cracks in the corners. This raw, dark, moist environment creates the perfect ecological niche for ambient yeast, like Candida albicans, or bacteria to settle in and colonize the tissue. The result is a cycle of painful, burning cracks that split wide open every single time you try to smile, talk, or eat a meal. Type the word crack in the chat right now if your lips split and bleed no matter how much lip balm you use. 6. Urticarial vasculitis, burning hives. Many people are completely familiar with standard, everyday hives, the kind of itchy, raised red welts you get if you have an allergic reaction to a new medication, a bee sting, or a specific food item. In medicine, we call normal hives urticaria. They are driven by histamine, they are intensely itchy, and the most defining characteristic of a normal hive is that it is transient, meaning a single welt will pop up, look angry, and completely disappear from that specific spot within 24 hours without leaving a trace. However, Sjogren's disease can trigger a much more deceptive and chronic variant known as urticarial vasculitis. On the surface, these lesions look exactly like standard hives: raised, swollen, erythematous plaques. But if you pay close attention, the differences are profound. First, while normal hives are purely itchy, urticarial vasculitis lesions feel much more like they are burning, stinging, or physically tender to the touch. Second, instead of vanishing within a day, a single welt will stay locked in the exact same geographic position on your skin for 24, 48, or even 72 hours. Finally, because this condition involves actual structural inflammation and damage to the underlying blood vessels, when the welt finally resolves, it doesn't leave clean skin behind. Instead, it frequently leaves a faint, yellow-brown, bruise-like discoloration or a pigmentation mark known as post-inflammatory hyperpigmentation. This is your immune system causing deeper vascular damage, not just a superficial allergic flare. If you get hives that burn or sting rather than itch, type the word hives in the comments right now. 7. Hypergammaglobulinemic purpura. This condition has an incredibly long and intimidating medical name, but its presentation on the skin is very distinct. It manifests as recurrent, sudden crops of flat, tiny, pinhead-sized purple or dark red spots across the lower legs, ankles, and sometimes extending up to the thighs. These tiny spots are called petechiae. This phenomenon is directly tied to a specific laboratory finding that we see all the time in patients with active Sjogren's disease: a massive overproduction of proteins in the blood, specifically a class of antibodies known as gamma globulins. Because the immune system is in a state of hyperdrive, the bone marrow and plasma cells pump out vast quantities of these globulins, making the blood structurally crowded with proteins. Over time, these excess proteins alter the dynamics of the bloodstream and cause mild, localized inflammation within the walls of the capillaries in the lower extremities. Patients will often notice that after a long day of standing on their feet at work, taking a prolonged walk, or engaging in physical exercise, a brand new crop of these tiny purple dots will pepper their skin, often accompanied by a mild warmth or an uncomfortable prickling sensation. Once the spots appear, they slowly fade over a couple of weeks, leaving a faint rusty brown iron stain on the skin from the leaked red blood cells, only to erupt all over again the next time the patient undergoes physical exertion. Comment the word spots right now if you have ever seen tiny red or purple dots appear after standing for a long time. 8. Hypohidrosis, inability to sweat. Let's look at a systemic sign that fundamentally alters how your body interacts with the environment: hypohidrosis, which is the medical term for a partial or total inability to sweat normally. Sweating is one of the most vital survival mechanisms your body possesses. When your internal core temperature rises due to exercise, stress, or hot summer weather, your brain signals your eccrine sweat glands to release moisture onto the skin surface. As that sweat evaporates into the air, it pulls heat away from your body, cooling you down safely. But as we discussed earlier, Sjogren's is an aggressive disease that specifically targets exocrine tissue. When the chronic inflammatory infiltrate damages your sweat glands, they become structurally compromised and cease to function. You might start to notice that during an intense workout where everyone else in the gym is drenched in sweat, your skin remains completely bone dry. While not sweating might sound like a cosmetic convenience on paper, it is actually incredibly dangerous. Without the ability to sweat, your body completely loses its capacity to regulate its internal temperature. This leads to severe heat intolerance. When exposed to heat, you may experience sudden dizziness, a rapid heart rate, nausea, and a profound, bright red flushing across your entire face, neck, and chest as your cardiovascular system desperately dilates every available blood vessel to dump core heat since your sweat glands can't help. Type sweat in the comments if you barely sweat even when working out in intense heat. Let's see how many of you experience this. 9. Eyelid dermatitis and chronic blepharitis. We frequently have patients walk into our dermatology clinics complaining of chronically red, dry, scaly, and intensely irritated skin on their upper and lower eyelids. Most of the time, they are convinced they are dealing with a localized contact allergy. They suspect their new mascara, a specific face wash, or a laundry detergent is causing the issue, so they stop using them. But despite changing their routine completely, the eyelid irritation never goes away. In a patient with Sjogren's disease, this presentation is often an external reflection of an internal moisture deficit. The severe lack of tear production from the lacrimal glands doesn't just make the eyeball itself feel dry and gritty like sand. It fundamentally alters the entire environment of the surrounding eyelid tissue. Furthermore, the delicate oil glands that line the margins of your eyelids, known as the meibomian glands, frequently become inflamed and occluded as part of the systemic exocrine destruction. When these oil glands fail, the tears evaporate instantly, and the lid margins become chronically red, crusty, and inflamed, a condition known as chronic blepharitis. The constant inflammation and lack of protective lipids spill over onto the surrounding eyelid skin, causing it to become chronically dry, wrinkled, and flaky, presenting as persistent eyelid dermatitis. Drop the word eyes in the chat right now if your eyelids are constantly red, flaky, or irritated. Put it in the text. 10. Diffuse hair thinning. When we evaluate the skin, we aren't just looking at your arms and legs. The scalp is a massive, highly specialized extension of your skin, and it is highly susceptible to systemic autoimmune shifts. Many individuals dealing with Sjogren's disease begin to notice a distressing, gradual, diffuse thinning of their hair across their entire scalp, alongside a profound shift in the overall quality and texture of their hair strands. Your hair follicles require a highly regulated, nutrient-rich, and well-hydrated microenvironment to successfully complete their growth cycles. Under normal conditions, the sebaceous glands attached to each hair follicle secrete sebum to naturally coat, lubricate, and protect the emerging hair shaft. When Sjogren's destroys these oil glands, the hair emerges into a harsh, unlubricated environment. It becomes incredibly dry, brittle, straw-like, and loses its natural luster and shine, making it highly prone to snapping and breaking off midshaft. Furthermore, the chronic, systemic inflammatory state circulating throughout your body can prematurely shock a high percentage of your hair follicles out of their active growth phase, anagen, and push them directly into the shedding phase, telogen, leading to excessive hair fall when showering or brushing. Additionally, Sjogren's is known to occasionally overlap with other distinct autoimmune hair conditions, making a comprehensive scalp evaluation absolutely necessary. Comment the word brittle right now if your hair has suddenly become incredibly dry, fragile, and thin. 11. Non-healing skin ulcers. Finally, the 11th and most clinically urgent sign on our list is the development of open skin ulcers, which most commonly form on the lower legs, around the ankles, or on the feet. An ulcer represents a complete, full-thickness breach in the skin surface where the tissue has actively died and sloughed away, exposing the deeper, raw layers underneath. How does a systemic moisture disease cause an open sore on the leg? It all goes back to the blood vessels. If a patient has severe, unmanaged cutaneous vasculitis, the intense inflammation inside the small and medium-sized blood vessels can become so profound that the walls of the vessels swell shut, or localized blood clots form within the inflamed channels. When this happens, the localized blood supply to a specific patch of skin is completely cut off. Deprived of oxygen and vital nutrients, the skin tissue undergoes localized necrosis, meaning the cells die. The skin breaks open, creating a deep, painful ulcer. These sores are notoriously difficult to heal because the underlying blood flow is compromised, and they serve as an open gateway for dangerous bacterial infections. If you ever develop an unexplainable, painful open sore on your lower extremities that refuses to heal after a couple of weeks, you must seek professional medical intervention immediately. If you have an open sore or ulcer that refuses to heal, type the word ulcer down below right now. If you have read through this comprehensive list and recognized several of these signs within your own body, please take a deep breath and do not panic. It is incredibly vital to remember that many of these symptoms, especially generalized dry skin, mild hair thinning, or primary Raynaud's phenomenon, are remarkably common in the general population and can be caused by completely benign, non-autoimmune factors. Having one or two of these signs does not automatically mean you have a serious systemic disease. When we evaluate a patient in a real-world clinical setting, we never look at a single skin spot in isolation. We look at the whole context, the whole person, and the entire systemic timeline. We look at your laboratory trends, your symptom combinations, and we carefully put together all the individual pieces of the clinical puzzle to evaluate your true risk profile. However, if you are experiencing a persistent combination of these unique skin manifestations alongside classic systemic symptoms, such as eyes that feel constantly gritty, dry, and burning, a mouth so dry it makes it difficult to swallow dry food without water, or chronic, unexplained joint fatigue and pain, it is highly worthwhile to take action. Do not rely on internet forums or social media video clips for a final diagnosis. Schedule a dedicated consultation with a primary care doctor, a board-certified dermatologist, or a rheumatologist. These medical professionals can easily run a highly targeted autoimmune blood panel. They will check for specific, well-established serological markers, including anti-SSA, Rho, and anti-SSB, La, antibodies, as well as rheumatoid factor and antinuclear antibodies, ANA, which can quickly and accurately give you an objective look at what is going on inside your body. In this era of modern medicine, our therapeutic options have advanced immensely. We possess incredible target treatments, systemic immunomodulators, and advanced topical regimens that can effectively cool down a hyperactive immune system, restore moisture balance, and safeguard your tissues. Getting ahead of systemic autoimmune inflammation early is the single most powerful step you can take to protect your skin, preserve your long-term comfort, and secure your overall health. Have you or someone you love noticed any of these unusual skin signs lately? Let us know your thoughts. We appreciate you being here, stay educated, and we will see you in the next video.